Good, happy Wednesday afternoon, May 13, 2020. I'm Riley King, and welcome to this afternoon edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this afternoon, so let's begin. First up, COVID-19 key information. Let's take a look for New Hampshire. And here is a look at that COVID-19 in New Hampshire key information. There are 3,239 number of people in New Hampshire who have tested positive for COVID-19. 1,408,073 number of people in the United States who have tested positive. 142 number of deaths from COVID-19 in New Hampshire. 319 number of people who have been hospitalized with COVID-19 in New Hampshire. And 83,368 number of deaths from COVID-19 in the United States. This map of New Hampshire right here shows you where current cases of COVID-19 are in towns and cities of New Hampshire. Salem, 103. And then this map here shows you total cases of COVID-19 in towns and cities of New Hampshire. Salem, 195. And let's take a look at this chart now. This chart here, new cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations. And in the red are the deaths. This chart here, current cases. In the purple, current COVID-19 cases. And in the orange, current hospitalizations. In this chart here, total cases. In the purple, total positive COVID-19 cases. In the orange, total hospitalizations. In the red, deaths. And in the blue, recovered. This chart here shows you by age group. This chart here shows you by female and male. This chart here shows you risk information. This chart here shows you race/ethnicity of cases. And this chart here shows you percent of New Hampshire population. And again, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, how it spreads, and prevention tips. Be sure to stay with the Riley King Network for the latest of your COVID-19 information. New COVID-19 testing site planned for Concord as New Hampshire tries to increase testing. Site tries to reach and exceed goal of 1,500 daily tests. Let's take a listen to that video from WMUR News 9, Adam Sexton.
Strict attention to detail. That's what sets Kubota construction equipment apart. It's how we maximize performance, increase strength, and give you the dependability you demand. We engineer our equipment precisely at every level. It's what makes us a leader. Now get financing as low as 0% APR for up to 60 months. See your local Kubota construction equipment dealer today. Where best meets second to none, MD.
The state will soon be setting up another drive-through COVID-19 testing site, this time on Stickney Ave in downtown Concord, as part of the ongoing effort to boost testing numbers beyond the current goal of 1,500 per day.
Constantly trying to increase testing capacity here throughout the state for the traditional COVID tests, working in conjunction also with Clear Choice, which is now doing a lot of our antibody tests here in the state. So this is just another step, but not the final step by any means. We're going to keep building on that.
As attempts to ramp up testing continue, the governor is also trying to balance calls from some to more rapidly reopen the economy with concerns from others that things are moving too quickly.
I think the state is taking some very sensible steps to flex open. Everything we do has the guidance and support of the Department of Public Health, some great epidemiologists, all the other folks within that department, which are just really good at understanding the data and knowing what we're doing and making sure we're taking viable steps. Our guidance documents that we're putting out are very robust. In fact, I'll put our guidance documents against almost any other states out there.
Public health officials will be watching closely to see how the virus responds to the loosening of restrictions on sectors like retail and hair salons. But the governor says other reopening steps will move forward in the meantime.
There's probably 2 or 3 weeks down the road before we see the true impacts, if there is any, of the steps we're taking here. Doesn't mean we can't take other steps, but with these areas, we're probably going to wait to see where the data goes.
Now, the Stakeholder Advisory Board for the Gopher, the Governor's Office for Economic Relief and Recovery, met today and heard from New Hampshire hospitals. The Hospital Association president saying that system-wide losses for New Hampshire so far topped $300 million by the end of April and could eclipse $500 million by the end of this month. Reporting live in Concord, Adam Sexton, WMUR News.
Okay, and there you go on that video and that report. Owners of 100 Massachusetts restaurants urging Governor Baker to let them reopen. Let's take a listen to that video from WCVB Boston.
Brigham Health is working around the clock to defeat COVID-19. You can help our efforts by giving to our response fund, donating supplies, or hosting a fundraiser. We're stronger together. Learn more at bwhgiving.org/help.
More than 100 restaurant owners are taking their case directly to Governor Baker, saying they'd like to open partially by next week and then go to full capacity in June. Take a look at a letter that they actually wrote to the governor, quoting, "We can operate safer than a Walmart, Target, Home Depot, or supermarket, which host many more customers per day, are not usually as clean, and 6 feet distance is close to impossible." Now, it's a struggle definitely being felt here in the North End, and even for restaurants who are not part of this collective plea. Boston is looking at expanding outdoor seating to try and help struggling eateries, something small spots would welcome.
Putting some tables out, I don't know whether it'd be right on the sidewalk or out, by the curb of the street. But I think anything of that caliber to help us restaurants that have been here for a while, possibly get some extra revenue would be great.
As for the group pushing to reopen more fully, they argue the restaurant industry is one of the most regulated in the state. As for the governor, he said he won't make any decisions about the restaurants until at least next Monday. Reporting live in the North End, I'm Ted Wayman, WCVB News Center 5.
Okay, and there you go on that video and that report. Maine tourism groups urge governor to remove 14-day quarantine for out-of-state visitors. A group of Maine tourism organizations is asking Governor Janet Mills to remove the 14-day quarantine for out-of-state visitors as summer tourism season approaches. Currently, anyone coming to Maine from out-of-state must quarantine for 14 days unless they are coming to the state to perform essential work. The tourism group wrote an open letter to Mills saying the tourism economy is on the verge of collapse. The group said they will create and enforce health and safety protocols and follow the state's guidelines for reopening. Under the governor's reopening plan, consideration of removing the 14-day quarantine requirement would not happen until July at the earliest. The tourism group said they would establish protocols for monitoring the health of their staff before they interact with customers and will work with municipalities to ensure open communication. The group said Maine's tourism economy is responsible for 110,000 jobs and contributes $600 million in taxes annually. Hospitality Maine, the Maine Tourism Association, the Retail Association of Maine, and Visit Portland and Visit Greater Bangor, the Maine Campground Owner Association, and Ski Maine all signed onto the letter. Happening right now in Vermont, Governor Scott provides updates on the state's COVID-19 response. If you want to watch that live press briefing, you can just go to mynbc5.com to see that and then click on the link. Rhode Island says number of coronavirus patients in hospitals continues to fall. The Rhode Island Department of Health on Wednesday reported 18 more coronavirus deaths for a total of 462 fatalities. The state record 221 new cases, bringing the total number of positive cases in the state to 11,835. RIDOH said 269 patients were in the hospital, which is another drop and continues a downward trend for 10 days. State looks to increase testing at nursing homes. Let's take a listen to that video from WFSB Eyewitness News 3.
One of the biggest challenges Connecticut faces is protecting our most vulnerable. COVID-19 has swept through nursing homes in our state, but the governor says soon we will take a major step toward keeping everyone in those facilities as safe and healthy as possible. Channel 3's Roger Susanna joins us now. He's live outside the Department of Public Health to explain what's happening. What do we know, Roger?
Well, Eric, at this point we do not have an exact timeline, but the governor says his next major goal is to make sure every person that works in or lives at a Connecticut nursing home is tested in the very near future for COVID-19. Now, listen, if you've driven around lately, you've probably spotted more of these mobile testing facilities like this one outside St. Francis Hospital in Hartford. But what you haven't seen is the increased testing that is going on inside Connecticut's nursing homes. Governor Ned Lamont says there has been explosive growth in testing throughout the state, and that trend will continue. Last week, the governor's office says about 18,000 people were tested. This week, he expects that number to reach 29,000. And then next week, the key reopening week, the governor's goal is for healthcare workers to administer around 42,000 tests statewide. The governor believes increased testing will make people more confident before returning to some form of normalcy. But before people without symptoms are tested, state leaders want to first take care of the people who are most at risk.
What that means in terms of giving you some comfort that we're able to test everybody at the nursing homes, testing the vulnerable population, testing the folks in corrections, testing each and every one of the first responders.
And coming up at 5:30, we're going to talk about why the governor believes this explosive increase in testing makes him more optimistic about the state partially reopening on May 20th. Reporting live in Hartford, I'm Roger Suzanne, Channel 3 Eyewitness News.
Okay, and there you go on that video and that report. Stocks fell for a second day. Dow now down 400 points. Stocks fell on Wednesday as investors grappled with concerns around the economy reopening, along with downbeat remarks from the top-ranking Federal Reserve official aimed jitters about reopening the economy. Price hike. Grocery prices are rising at the highest rate in nearly 50 years. And experts warn the price increase likely won't end soon. Let's take a listen to this video from ABC News.
Prices at the grocery store are on the rise. They're increasing at the highest rate since the 1970s. ABC's Inez de la Cantera has more.
This morning, sticker shock at the supermarket.
Last year at Memorial Day, our hamburger price was $3.99 a pound. It's going to be $5.99 a pound this year.
Grocery prices jumping by more than 2.5% since April, the biggest one-month bump in nearly 50 years.
People are staying home, they're not going out anymore, and so there's a big increase in regards to sales in grocery stores.
Prices of mealtime staples like poultry rising by more than 4%, ground beef up almost 7%, while eggs skyrocketed by 16%. And experts warn the cost increases likely won't end soon.
Consumers can expect price increases, and so you'll see anywhere from 2 to 4% probably for the remainder of the year.
It comes amid new woes for one of the nation's biggest pork suppliers. Tyson's Food revealing that more than 200 employees have tested positive for coronavirus at a company plant in Nebraska, while a facility in Maine is dealing with a second outbreak just 1 week after reopening. Those closures, just one part of the stress the pandemic is putting on our food supply. The Food Industry Association also points to new safety protocols and supply chain issues contributing to cost increases. Adding to the price problem, stores facing huge demand are foregoing weekly sales and specials, so no discounts for customers. Kenneth and Mona?
All right, Inez, thank you. And
Okay, and there you go on that video and that report. And that does it for this afternoon edition of the Riley King Newscast right here on the Riley King Network. Thank you for joining us this afternoon. Have a great rest of your afternoon, and I'll see you back here later on today for another newscast. Goodbye, everyone.